Go ahead, ma'am.
Good evening, everyone. Uh, Good evening, everyone. Myself, Dr. Kanchan Durugkar. I am fertility specialist at Oasis Fertility Pune. Today, we are here for our another Facebook live session, and our today's topic is facts and myths about IVF treatment. Today we are going to discuss about the most common myths that are there in patients' minds about IVF treatment, and of course about the facts which are there about the IVF treatments. So, what are the myths of IVF that we are going to first discuss? So, what are the myths about IVF treatments? We first myth is IVF is a very painful procedure. So, as we have earlier also discussed in our Facebook live session, that IVF is not a painful procedure. Yes, we have to give injections to stimulate the ovary, but it is not a very painful procedure. Injections, those are given, they are subcutaneous injections, so not very painful injections. Then the procedure that is ovum pickup that is undertaken, that is also under anesthesia, so that there also the pain is not there. Then other myths is that the IVF is only for the infertile couples, so it is not so. IVF is not only for the infertile, whoever are not uh, able to conceive, for them IVF is there. But for those couples who are having recurrent pregnancy loss, or who are having the problems with uterine anomalies like absent uterus, or ovarian failure, or primary amenorrhea, for those patients also IVF is useful. So it is there. These are the different reasons for infertility. But along with infertility, for the patients with recurrent pregnancy loss also, and also the patients with cancer for whom the fertility preservation is necessary, for them also IVF is necessary. Now, the another third myth that we are going to discuss is it leads to multiple pregnancy only. So this is the common myth. So it is not like that. If we are yes, the transfer sometimes more than one embryo, two embryos, to get the good success rate. But it is not necessary that every patient will have a multiple pregnancy. If at all we don't want the multiple pregnancy, we can go for single embryo transfer also. So that will lead to a singleton pregnancy only. So that is on the patient's wish also, that the whether they want a single pregnancy or they are okay with twins also. So it is not necessary that every patient is with IVF will have twins only. Then it is the only treatment. Other myth is that commonly we notice is that is the only treatment for the infertile couple. So it is not so. It is one of the treatment for IVF, like one of the treatment for conceiving. Like there can be the different treatments available for the patients who are coming. There can be a treatment of ovulation study, there can be a treatment of IUI, or if at all that those treatment fails, then there can be a treatment of IVF. So it is not necessary that every patient, every infertile couple will need IVF only. So that this is also one of the common myth. Then other one myth is fertility treatment or fertility injections that are taken during the IVF, they are harmful for women's body. So various data is published, various papers are published. They say that these gonadotropins that we give, the injections that are given for ovarian stimulation, long term their effects have been seen. So they have shown that this gonadotropins injection, or the injections that we give during the, or tablets that we give during the fertility treatment or IVF treatment, they are not harmful for the patients. Now, other myth is that the baby that are conceived after IVF treatment. So the baby that are conceived after IVF treatment, they can be abnormal baby because they are born after artificial technique. So it is not like that. Though the babies that are born, They are through ICSI technique. ICSI is the intracytoplasmic sperm insemination. That technique is the recent technique that we use in Oasis. Also, we use this technique. Then we use, along with that, we use laser assisted hatching. Then frozen embryo transfer that we use. Whether it can be a frozen or a fresh embryo transfer, but the babies that are born with IVF, more than 40 years, the IVF technique has evolved. But the whatever the papers are published, or whatever the data that is available in these years, they say that the chances of congenital problems are same as that the natural conception. Means if the patient is conceiving naturally, even though there are some 5 to 5% chances are there that the naturally conceived baby can have some or the other problem. This is the problem 5% patient can have. So same rate of congenital problems are there with IVF conceptions also. So IVF, if the patient has undergone IVF, that doesn't mean that the rate of congenital anomaly is far more than the patients who are conceived naturally. Though the process is artificial, the process is going outside, that is in the IVF lab, but that doesn't mean that the congenital anomalies are more, or the percentage of congenital anomaly is more in the patients who are undergoing IVF treatment. So the babies that are born through IVF treatment, they are as normal, or as same as the natural conceived babies. If they go proper, the pregnancy is going well and good. So this is again the common myth. So the babies that are born by IVF, they are actually the normal babies. They are not different from the babies that are born by natural conception. Now, another one more myth is that it is IVF is not a safe and sound procedure. So it is not like that. As I discussed earlier points, that IVF is a safe procedure. The injections that are given to the lady who is undergoing IVF procedure, they are safe. Then the procedure that we do, that is the egg retrieval that we do, that is the only surgery that we do during the IVF procedure. That procedure is also under anesthesia, painless procedure. It is a safe procedure. Here the patient is not given any incision, so they don't have any stitches. So the egg retrieval is done like the ultrasound is done per vaginally, it is done. So egg retrieval is also per vaginal, so no stitches are there even with the ovum pick. And then embryo transfer is also a safe procedure, and the success is also there. Now, other myth that commonly the patient have is the IVF is the last and it has a 100% success rate. So again, this is also a myth that I want to clear, that IVF is one of the process that we give to the patient. That is one of the treatment. It doesn't have 100%. It has success. Center to center, it will vary. So in OSS, we have 60 to 70% success rate. So no, it is not 100%. If we are going through IVF treatment, we expect, because for the patient, for a patient, a couple who is coming to us, it is a last treatment that they are taking to become parents, for a woman to become a mother. So for them, it is a last treatment that they are taking. But again, there is a chance that IVF may fail. It doesn't have success rate of 100%. So we can face failures, but it doesn't mean that if the first IVF it has failed, that doesn't mean that you cannot conceive, you cannot have a baby. Sometimes it may fail, but then we need to evaluate what is the reason for IVF failure, why the IVF has failed. Was there any problem in the endometrium? Was there any problem in the embryo? Was there any problem in the adnexa, or any other problem that has been there? So these problems we need to evaluate, and if at all any addressable problems are there, then before going for the next embryo transfer, we need to rectify that problem which we have seen, and which has not made the IVF, first IVF successful. So if at all that first IVF has failed, we can think of and rectify the problem that has been there, and then we can go for the embryo transfer, which can bring us the success. So it is not like the 100%, but yes, if the IVF cycle has failed, it doesn't mean that you cannot conceive. You can conceive, but you may need one more step that needs to be rectified, and yes, you can definitely achieve success. Then, and again, one more myth is that the fertility drugs may can cause cancer. So it's not like that. Some patients may feel that since the injections are given to stimulate the ovary, so ovarian size is increased. So in future, I may have cancer. So it is not like that. For these drugs have been tried and tested. Animal studies are first carried out, then human studies are carried out, and when the safety of these injections is proven, then and then only they are made available for use for all the patients. So their safety is first checked, and then only they are used for the practice. So they are safe. These injections are safe. Then uh, now we will come to the facts of this IVF treatment. Now, what are the facts? Many of the couples have have the conception that these in IVF, their own gametes are not used. Sometimes the donor gametes or other gametes are used. The baby that is born, that is not that is not a biological baby they are going to have. It is not like that. So the gametes that are used in IVF are your own gametes. As far as there is no problem in your own gametes, your own like ovarian reserve or the sperm count, if there is no problem in that, then we try to the maximum that the embryos that are formed and the baby that you give that you conceive are from your own gametes only. Now, other myth is it can be other fact that we are going to discuss. It is it can be used for fertility preservation. So how can the IVF help in the fertility preservation? The couples who are not planning or who are planning for the late, they're not planning right now and they want to plan it like 5 years later, but they are worried about their fertility. So in those patients, the fertility preservation in those patients also are useful for them. Fertility either egg freezing or more favored is the embryo freezing can be done, and their fertility can be preserved, and then whenever they want the child, they can have child by this fertility preservation method. Again, fertility preservation method is useful for the patients who are having cancer, like they are going to undergo chemotherapy or radiotherapy, which can be gonadotoxic. In those patients, IVF can be useful, where we can preserve their if the patient is not married, then we can preserve her eggs, and if she is married, then better to preserve her embryos. In this way we can preserve her fertility, and for them IVF is like a bliss. Now, other fact that we want to discuss is uh, the usefulness or the success where it can be successful. So it can be successful in the patients who are having low ovarian reserve. It can be successful who are having previous IUI failure. It can be successful in the patients who are having previously repeated pregnancy loss, or the patients who are having previously ovulation during the IUI cycles, they have not conceived. Previous IUI failures are there. In these patients, IVF can be successful. Now, other thing is the cost related. That is, it is a very costly procedure. It is not like that. The procedure has uh, some cost is there. Of course, the injections are have some cost, but yes, we can have these things also sorted out, that how it can be done according to patients affordability also, that also we consider at Oasis. So that also is the thing. Then about the success, so the recent advances that are used, like the blastocyst culture, then the laser assisted hatching, frozen embryo transfer, these things does enhance the success rate of the patients who are uh, who have tried earlier also, and now they are not having the conception. In those patients also, IVF can be useful. And then other facts about this are about the ovarian stimulation e- and egg pickup and embryo transfer. So this process can be a fresh embryo transfer also, or a frozen embryo transfer also. So ovarian stimulation can be done with different protocols. That depends upon patient to patient. Like for the patients who are having low ovarian reserve, poor ovarian reserve, for them the protocol can be different. For the patient who are PCOS or previous history of hyperstimulation is there, they for them the ovarian stimulation protocol can be different. So the treatment of the patient is stratified according to the problem of that patient. So the individualized approach for the IVF is very important to get the success rate. Then comes the egg retrieval and embryo transfer. Then before embryo transfer also, the endometrial monitoring. Then if at all any problems with endometrium, like if at all thin endometrium is there or polyp is there, then we can do the hysteroscopic polypectomy, or if the thin endometrium is there, then hysteroscopic PRP installation, that we can do before going for embryo transfer. And then when the optimal situation is achieved, then embryo transfer can be done. So this is how the procedure is of IVF is carried out, and protocol differs. Then as the ovarian stimulation protocol differs, accordingly the sperm selection techniques may differ. Like we can offer, if the patient's DFI is rest, then MAX, that is magnetic associated cell sorting, that sperm selection can be used, or microfluidics, that is a sperm selection technique, that also can be used as a for selecting the good morphology sperms to have the better embryo quality. This sperm selection can be used. Or if at all there is a severe oligoasthenospermia, severe oats, then in those patients, or if there is a patient in whom the sperm count is nil, in those patients we can use the sperm aspiration techniques also, that we call as a TISA. TISA is testicular sperm aspiration. In this, the eggs are directly extracted with needle from the testicles. This is called TISA. That this TISA technique can be used for the patients who, for in whom it is not possible, if we don't have the sperm count which is required for IUI. Like if the sperm count is very less, in those patients these methods can be useful, and these patients can achieve pregnancy with their own sperms, with their own gametes. So these patients are blessed. For the patients who cannot conceive it naturally or with IUI, in with his procedure they can achieve pregnancy with their own gametes, of course. So these are the different individualized treatments for the patients. So it is not the same treatment which the patient generally think IVF is the same treatment for everybody. It is not like that. At Oasis, we follow the personalized treatment plan for every patient according to their problem. The personalized treatment plan we plan, and then accordingly the treatment is carried out. So these are the some myths and facts about IVF. I hope I have addressed at least the common myths and facts that we come across when patient come to us. With the problem of infertility or not conceiving. So I think I have addressed most of them. If at all any doubts you have, or if at all any other queries that you have regarding this topic or any other topic, you can feel free to call us on our helpline number, which is flashing on your screen. Or you can have a physical consultation with us. We have our center at Oasis Fertility Vakad and Kharadi. So feel free to contact with us. Thank you very much. Have a good day.